Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been feeling quite overwhelmed with all these health issues lately. My asthma has been quite bothersome, especially with the recent episodes of chest pain and shortness of breath. I was scared it was my heart, but thankfully it wasn't. I've been using my nebulizer more often because the regular inhalers don't seem to help as much when it gets really bad.
I understand that must be quite distressing for you. We definitely need to keep a close watch on your asthma to manage it effectively. How often have you been needing to use your nebulizer?
Lately, it's been about twice a week. The weather changes seem to trigger it more. Besides that, my back has been giving me a lot of trouble. It's the pain and the fact that I can't move around easily. I've been using a walker. Without it, I feel very unstable.
Mobility issues can certainly complicate things. We'll look into additional support for your chronic pain. You mentioned your back pain has worsened. Has there been any particular incident that made it worse, or is it progressive?
No specific incident, just the wear and tear over the years, I suppose. And the osteoporosis diagnosis doesn't help. It's just been progressively getting worse. As for my colon cancer, I'm relieved the tests show no recurrence, but the bloody diarrhea episode was quite a scare.
Yes, I see that noted here. It's good that there's no sign of recurrence, but we should certainly keep monitoring your gastrointestinal health closely. Have you noticed any improvement with the omeprazole for your reflux?
The reflux is a bit better with the medication, but not entirely gone. And speaking of medications, keeping track of them all is becoming a chore. With my recent stay in the hospital, my appetite hasn't been the same either. I've lost weight and just don't enjoy food like I used to.
Nutrition is crucial, especially in your situation where weight loss can impact your strength and overall health. We might need to look at more appealing dietary options for you. Additionally, your lab results showed iron deficiency anemia, which is likely contributing to your tiredness and weakness.
Yes, the iron supplements. I hope they help. I've been taking them, but haven't noticed much change yet. It's all a bit much sometimes, trying to manage everything.
I can only imagine. It's important to address each concern systematically. Let's go through the current plan and see where adjustments are needed. First, concerning your asthma, it's clear we need to possibly revise your management plan given the increased use of your nebulizer. Regarding your mobility, we might consider physical therapy to strengthen your muscles and improve stability. This could potentially help with the pain as well.
That sounds like a good approach. What about my bones and the osteoporosis?
For the osteoporosis, starting treatment with alendronate to improve your bone density is the next step. This should help reduce your risk of fractures and potentially lessen your back pain over time. Now let's review your recent lab results to guide further management. Your blood pressure and heart rate are stable, which is good. Your CBC shows hemoglobin at 11.2 qPL, which is on the lower side, justifying the need for iron supplementation. Your kidney function is stable, and liver tests are within normal limits, which is reassuring.
What about my cholesterol and other blood levels?
Your lipid profile is fairly controlled, with an LDL of 100 mg per deciliter and HDL at 55 mg per deciliter. However, we'll continue to monitor these levels closely, especially considering your past health issues. Your electrolytes and metabolic panel look good, which is excellent. Moving forward, we'll keep a close eye on your gastrointestinal symptoms, ensure you have the right supports for mobility, and adjust your asthma medications as needed. We'll also arrange for a follow-up on your bone density treatment and monitor the effectiveness of the iron supplementation closely.
I appreciate that, doctor. It's a lot to keep track of, but I'm glad we're on top of it.
Absolutely, and I'll make sure we coordinate with your other healthcare providers to keep everything streamlined. We'll schedule another appointment to reevaluate how you're doing with the new adjustments in a few weeks. It's important that we manage these conditions proactively to maintain your quality of life.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been having these numbness and weakness issues with my left hand, especially in the first 3 fingers. It's been tough to handle daily tasks, and my last 2 fingers are also becoming difficult to use. Additionally, I have numbness and sometimes cramps in my right leg and foot when I point my toes.
I understand. It sounds like these symptoms have been quite challenging for you. Can you tell me more about when you first noticed these problems?
The hand issues started a few months ago. Initially, I thought it might go away, but it only got worse. The leg and foot problems began around the same time. It's sporadic, but when it hits, it's really uncomfortable.
Thank you for sharing that. Let's also discuss the rash you've mentioned. How has it been behaving lately?
Oh, the rash has been persistent. It's been about 1.5 years now. These itchy red splotches on my arms and neck just won't go away. I've tried several creams, but nothing seems to work. It even spread to my wife at one point, but hers cleared up.
It must be frustrating to deal with that persistent discomfort. Have any of these treatments brought even temporary relief?
Not really, doctor. Sometimes the itching eases a bit, but the redness and splotches remain as visible as ever.
I see. Let's make sure we address that effectively with the dermatology team. Now, regarding your medical history, you mentioned a past episode treated with an epidural and gonorrhea during your military service. Have there been any other significant medical events or treatments in the past?
Not much else significant. Just those events and the usual ups and downs. I'm really focused on trying to quit smoking too. I've cut down a lot using nicotine patches.
That's a positive step towards better health. Quitting smoking can significantly impact your overall well-being. Now, regarding your symptoms and history, We've planned some investigations to get to the bottom of the neurological issues. We suspect there might be nerve compression, possibly involving the ulnar nerve at your elbow or issues in your cervical spine.
I see. So what should I expect with these tests?
We'll start with nerve conduction studies to assess the function of your nerves and possibly an MRI if we find anything that needs further examination. For your rash, we'll refer you to a dermatologist and try restarting the Selsun lotion to see if it improves your condition.
Got it. What about the elevated white blood cell count?
That's likely related to inflammation, possibly due to your rash or another underlying issue. We'll keep an eye on it with some follow-up lab tests. Now I have your recent clinical values here as well. Blood tests show normal hemoglobin A1C, liver functions, iron studies, and electrolytes. Your cholesterol levels are within a healthy range. Total cholesterol at 165 mg dl, LDL at 78 mg dl, and HDL at 67 mg dl. We're still waiting on the results from your chest X-ray and have ordered urine analysis to rule out any infection. Our plan is to monitor your white blood cell count closely in our follow-up labs, scheduled for 3 weeks from now. We'll also reassess any changes post-treatment for your skin rash.
Sounds thorough, Doctor. I appreciate your help sorting out these issues.
Absolutely. We're here to support you through this. Make sure to keep us updated on any changes or new symptoms, and we'll address them as needed. Our goal is to manage these symptoms effectively and improve your quality of life.
Thank you, Doctor. I'm hopeful we'll get to the root of these problems soon.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Dr. Foster, the latest labs for our patient with chronic kidney disease show elevated potassium levels. This could be problematic considering his current medication regimen.
Yes, hyperkalemia can be quite dangerous. We need to adjust his medications to prevent any cardiac complications. Which drugs is he currently on?
He's taking an ACE inhibitor and a beta blocker. I'm thinking we should discuss potentially switching the ACE inhibitor to a calcium channel blocker.
That's a sensible approach. Let's also review his diet and make sure he's avoiding high potassium foods. Can you arrange a consultation with the dietitian?
I'll set that up right away and also schedule a follow-up blood test in 2 weeks to monitor his potassium levels.
Now look at question 26.
Nurse Reynolds, I noticed that during the night shift, the noise levels in the ward often exceed the recommended decibels. This can impact patient recovery.
Yes, Dr. Lee, I've observed this as well. Some of the equipment is quite old and noisy, and there are frequent staff conversations near patient areas.
Let's look into quieter alternatives for the equipment and perhaps implement a quiet hours policy that limits conversation and reduces activity near patient rooms during certain hours.
I think that's a great idea. We could also post signs reminding staff and visitors to keep their voices down.
Perfect. I'll draft a proposal for these changes and discuss it at the next staff meeting. Let's make sure we create a restful environment for our patients.
Now look at question 27.
Mrs. Lopez, your daughter Emily has been showing signs of type 1 diabetes, including increased thirst and frequent urination. Have you noticed any other symptoms at home?
Yes, she's been very tired lately and she's losing weight even though she seems to be eating more than usual.
Those are consistent with diabetes. We'll need to start her on insulin therapy to help manage her blood sugar levels. It's also important that she has regular checkups to monitor her condition.
I'm worried about how she'll handle the injections. Is there any other way to manage it?
Currently, insulin injections are the most effective method for managing type 1 diabetes. We can refer you to a diabetes educator who can help Emily become more comfortable with the process.
Now look at question 28.
Hello, I'm Dr. Phillips, and I see that you're here for a follow-up on your hypertension. How have you been feeling since your last visit?
I've been feeling okay, but I've been having some headaches and dizziness occasionally.
That could be related to your blood pressure. Have you been monitoring it at home?
Yes, I have. The readings have been a bit high. I've been trying to cut down on salt and exercise more, though.
Those are good steps. Based on your symptoms and readings, we might need to adjust your medication. Let's also ensure you have a follow-up appointment for a blood test to check your kidney function, as it can be affected by high blood pressure.
Thank you, Dr. Phillips. I'll make sure to keep monitoring my pressure and stick to the diet and exercise plan.
Now look at question 29.
Dr. Thompson, I've reviewed the patient's symptoms and suspect that it might be Lyme disease. She mentioned frequent hiking in tick-prone areas.
That's a good catch, Dr. Lee. Did she show any signs of a bullseye rash or experience joint pain?
Yes, she has a rash, and she's complained of knee pain that has worsened over the past 2 weeks.
Let's start her on doxycycline as per CDC guidelines for Lyme disease and schedule a follow-up in 2 weeks. It's crucial we monitor her symptoms closely.
Understood, Dr. Thompson. I'll also educate her on tick bite prevention to minimize her future risk.
Now look at question 30.
Nurse Patel, in Mr. Green's case, we're seeing poor wound healing on his left foot. He's diabetic. What are your thoughts on his current treatment plan?
Dr. Sanders, I believe his blood sugar levels have not been well controlled, which can complicate the healing process. His current regimen may need reevaluation.
Agreed. Let's adjust his insulin therapy and perhaps introduce a wound care specialist to our team. Also, how often are his dressings being changed?
Currently every 48 hours, but given the lack of progress, increasing to daily changes with a more suitable dressing type might be beneficial.
Make those changes and document his progress. Keeping his blood sugar stable is key, and improved wound care should help accelerate healing.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Welcome to today's deep dive into a cutting-edge field at the intersection of technology and neurology, neuroprosthetics. We're joined by Dr. Laura Benson, a pioneering researcher and clinician specializing in this innovative area. Dr. Benson, could you introduce us to the world of neuroprosthetics?
Thank you for having me. Neuroprosthetics is a fascinating field that combines neuroscience, engineering, and robotics to create devices that replace or enhance the functions of the nervous system. These devices are not just about replacing lost motor skills, but are also increasingly capable of restoring sensory feedback, essentially bridging gaps caused by neurological damage or disease.
That sounds incredibly promising. Can you explain how these devices work?
Absolutely. Neuroprosthetics work by interfacing directly with the nervous system. For motor prosthetics, sensors in the device detect intended movements from the user's neural activity, often through muscle signals or directly from the brain. These signals are then translated by algorithms into movements of the prosthetic limb. Sensory prosthetics work somewhat inversely, where they convert external stimuli, like touch, into electrical signals that the brain interprets.
What are some of the most recent advances in this field?
One of the most significant advances has been in the area of brain-computer interfaces, or BCIs, which directly connect a device to the brain. This technology has enabled individuals with paralysis to control devices like computer cursors or robotic arms with their thoughts alone. Additionally, advances in materials science have led to more durable, lightweight, and biocompatible prosthetics, making them more comfortable and functional for long-term use.
Could you share a particular case where neuroprosthetics made a substantial difference in someone's life?
Certainly. One memorable case involved a young musician named Tom, who lost his arm in an accident. Tom received a state-of-the-art robotic arm with sensors capable of detecting muscle movements from his residual limb. Over time, and with a lot of training, he was able to play the piano again. This not only restored his physical ability, but significantly boosted his mental health and quality of life.
That's truly inspiring. What challenges do researchers and clinicians face in this field?
There are several challenges, notably the complexity of the human nervous system, which makes interfacing technology with the brain a daunting task. Additionally, there's the need for personalized calibration of devices, as each individual's neural patterns are unique. Ethical considerations also play a big role, especially concerning patient privacy and the long-term impacts of implanting devices in the brain.
Looking ahead, what future developments do you anticipate?
The future of neuroprosthetics lies in enhancing the integration and functionality of these devices. We're looking at fully implantable systems that can not only improve mobility, but also restore other functions, such as bladder control or even sight. Another exciting frontier is the potential for neural regeneration, where prosthetics could be used as scaffolds to support the growth of nerves and possibly restore function naturally.
Dr. Benson, it's been enlightening learning about the transformative impact of neuroprosthetics. Your work is not just improving lives, it's redefining possibilities for those with neurological impairments. Thank you for sharing your insights.
Thank you for highlighting this vital field. It's a privilege to help pioneer solutions that bring such profound changes to people's lives, and I look forward to seeing where the next advancements lead us.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Welcome everyone to our webinar on the intricate relationship between autoimmune disorders and mental health. Today we're joined by Dr. Sarah Bennett, a leading immunologist and psychiatrist from Harvard Medical School, who will share her insights into this complex interplay and discuss a compelling case study from her recent research.
Thank you for the introduction, and it's great to be here. Autoimmune diseases and mental health conditions have a bidirectional relationship, which can significantly impact patient management and outcomes. Today, I'll detail the case of a patient referred to as Case X to maintain confidentiality. Case X is a 34-year-old diagnosed with systemic lupus erythematosus, SLE, and concurrently battling severe depression.
Can you explain more about how autoimmune diseases like SLE can influence mental health?
Certainly. Autoimmune diseases cause chronic inflammation, which not only affects physical aspects such as joints and skin, but also impacts the brain. Chronic inflammation can lead to neurotransmitter imbalances and has been linked to depression, anxiety, and cognitive dysfunction. In SLE, for instance, inflammatory cytokines can cross the blood-brain barrier, potentially leading to neuropsychiatric symptoms.
That's quite insightful. Could you delve into how this manifested in Case X?
Case X initially presented with joint pain and fatigue, which are common in SLE. However, she also experienced persistent sadness, lack of interest in activities, and cognitive disturbances like difficulty concentrating and remembering. These symptoms initially led her to consult a psychiatrist, and only later, after a rheumatological evaluation, was the diagnosis of SLE made. This case exemplifies the complexity of diagnosing coexisting autoimmune and mental health conditions.
What are the implications of such comorbid conditions for treatment strategies?
Managing such cases requires a multidisciplinary approach. For Case X, we coordinated care between rheumatology, psychiatry, and neurology. Treatment involved immunosuppressive therapy for SLE and an antidepressant regimen. Additionally, cognitive behavioral therapy was introduced to manage depressive symptoms effectively. It's crucial to treat both the autoimmune disorder and mental health symptoms to improve the overall quality of life.
And how did these integrated treatment strategies impact Case X?
Over several months, we observed significant improvements. The joint pain and skin manifestations of SLE were well controlled with immunosuppressives, and her mood stabilized considerably with the psychiatric care and therapy sessions. This holistic approach not only alleviated her physical symptoms, but also enhanced her mental well-being, demonstrating the importance of comprehensive care in such complex cases.
Reflecting on this case, what are the broader implications for healthcare systems in managing similar cases?
This case underscores the need for early screening for mental health symptoms in patients with autoimmune diseases and vice versa. Healthcare systems should facilitate better integration of various specialties to provide cohesive care, which can be achieved through shared electronic health records and regular interdisciplinary team meetings. Moreover, patient education about the interconnectedness of physical and mental health can empower patients and encourage adherence to treatment protocols.
To wrap up, are there any misconceptions about the interrelation of autoimmune diseases and mental health that you'd like to address?
A common misconception is that the mental health symptoms in autoimmune disease patients are merely reactions to being diagnosed with a chronic illness. While the psychological impact of such a diagnosis is significant, the biological interplay of inflammation on mental health is a real and substantial effect that needs recognition and appropriate treatment. Another misconception is that treatment of the physical symptoms alone is sufficient. As seen in Case X, addressing mental health is equally vital.
Dr. Bennett, your insights today have been incredibly enlightening. Thank you for sharing your expertise and shedding light on this complex topic.
It's been my pleasure. Thank you for hosting this discussion. It's crucial to continue exploring and understanding the link between these conditions to improve patient care and outcomes.